when the VA was trying to deal with the opioid crisis, they were trying to get people into the pain clinic. The pain clinic had too long of a wait. They were looking for volunteers to handle people's pain at a less expertise level, more like listening to them, making sure they had all the labs, x-rays, and imaging that they needed to have done, making sure that they've gone through physical therapy if it was appropriate, making sure that they're not taking two of the same category of medicine and hurting their kidneys, making sure that they've tried a variety of prescription medicines and things that people can do, like stretches, yoga, and low inflammatory diets, and just different things that you can do from a primary care standpoint. But you need the time to sit down and actually go through this with people. And even a half an hour, which was the standard for VA, double what most people get to go through in primary care, is not quite enough to go through everything that people want to tell their whole pain story. And you have to almost have that to understand exactly what's wrong with them. They gave us an hour with each patient, which was a lovely blessing, let me tell you. We did get to go through a full history. We did get to make sure they had all their tick all the boxes of ordering, and we did get to listen to them, and that's therapeutic too. We got to problem solve the prescriptions that they were having this side effect from or that side effect from. Some people didn't want prescriptions, and some of them didn't even want to be on the opioids, but they were having trouble with the withdrawal side effects. We got to spend hour after hour with people dealing with chronic pain. That got me interested in all these what I considered side things, alternative medicine or complementary medicine. I started investigating that, started doing a little bit of yoga. I started to read up on pain management and learn about some devices that people could wear for compression or for stretching the neck, for supporting the back, or these devices that use ultrasound, cold or heat, just all kinds of alternative things that were more Western medicine. And then I started thinking about Eastern medicine. We had the opportunity to learn how to do what the VA called battlefield acupuncture, 5 points on the ear, auricular acupuncture. I signed up for that and eventually became a teacher for that. Really saw a lot of good results from that. And that piqued my interest in Eastern medicine, so that when it was time for me to transition from the VA for personal and growth reasons, then I decided, well, in this in-between period, I could just go into private sector and kind of be a hamster wheel, or I can see if I can find my skills to match the next job. It was hard to find a job where that would be valued unless you went fully through the Integrative Medicine Fellowship, which is a 2-year thing. And then that's 2 years I thought that maybe financially I didn't want to leave my family 2 years without an income. And then get started and have an unsurety. So as I was continuing to look for work, I was continuing to learn the yoga. I had time on my hands and a busy mind. So yoga and then meditation courses. And then I was like, if I don't have a job by this month, I'm just going to sign up for medical acupuncture, and then that will launch me into a new career. That's exactly what happened. When I came out of that, I also realized there aren't many jobs that even allow medical acupuncture in the hospital. You have to go through committees, you have to get the buy-in, blah, blah, blah. So I'm like, I'm just going to start a practice. And then I learned business while I was waiting to open my practice. Now, here's where I am. My practice is geared toward people who are interested in holistic medicine, kind of a different way to do things than just here, come in, 5 minutes, here's your prescription. They want to use less medicine. They want to get rid of pain. They want to get rid of whatever functional problem is bothering them. And sometimes it's something that medical Western medicine tells them, oh, it's no big deal, because it's not an official disease. It's not going to kill you, so just deal with it. People don't want to hear that. I wouldn't want to hear that. I didn't want to hear that when I had my problems. So this is an opportunity with direct care. You just pay the doctor directly. You can have pretty much all the time you need. It's concierge. And to have all the time you need, now you can delve into the background, the reason why. What are your stresses in your life? How does this relate to physical problems?